Hello and welcome everyone in today's nursing webinar session. Myself, Shanti Bhattacharya, the Vice President Nursing, Yashoda Hospitals, and we will be discussing about the very prevalent topic on PCOS and PCOD, its myths and facts. Let me take the privilege and honor to introduce our eminent speaker, Dr. Madhavi, who is our Senior Consultant, OBGYN and laparoscopic surgeon. I welcome you, ma'am, and very thanks for accepting the nursing webinar session today. Let me also welcome our very efficient speaker, Ms. Kavitha, who is AGM Nursing, Secunderabad, Yashoda Hospitals. I welcome you, Kavitha. So let us all discuss about the PCOD, which is polycystic ovary disease and syndrome, and diffuse few more criteria on its myth and facts. So let me just have the introduction about the PCOD and PCOS from Dr. Madhavi. Ma'am, how common is PCOD prevalence in the society?
Of late, PCOD's prevalence has increased in the society. It's around like 10 to 15% of the women we are seeing currently with the PCOD problems. What is PCOS means? First, we have to understand how a woman presents with PCOS. So, as per medical description, there are three criteria, Rotterdam criteria, where three clinical features are taken as the commonest thing. Out of these three, at least they should meet two of the criteria for them to be labeled as PCOS, which we call as polycystic ovarian syndrome. One of the very important clinical feature is when we see in the ultrasound, they'll be having multiple follicles, like 12 and above follicles will be seen, which we call as polycystic ovaries. And the second criteria is hyperandrogenism. These women will present with hirsutism, alopecia, excess hair growth all over the body. All these will be seen in these women. The third criteria for these women is anovulation or oligoovulation. Among these three, at least they should be having two clinical criteria for us to be label them as polycystic ovarian syndrome. Apart from this, they can be associated with other features like infertility, metabolic disturbances, obesity. All these also will be present in these women.
Okay, ma'am, thank you. And let's even hear more from the speaker. Kavitha, over to you.
Good afternoon, ma'am. Good afternoon, all.
You can start.
As discussed by ma'am, today's points for discussion. Difference between PCOS and PCOD. What are the causes, risk factors of PCOD and PCOS? Signs and symptoms, role of hormones, treatment and nursing management, dietary management. What is PCOS and PCOD? Polycystic ovary syndrome and polycystic ovarian disease are common endocrine disorder in women. Exact causes are not fully known. Many symptoms are caused by insulin resistance. What is the difference between PCOD and PCOS? In PCOD, the ovaries start releasing immature eggs that lead to hormonal imbalances and swollen ovaries. While in PCOS, endocrine issues cause the ovaries to produce excess androgens, which makes eggs prone to becoming cyst.
So do we have, ma'am, any more other differences as you mentioned that, the total number of ovaries which we get to see in this scan? Anything else we have to differentiate between PCOS and PCOD, ma'am?
Actually, this is a very good question which I want to answer because this question will be asked by many of my patients also. Very important thing is there is nothing like PCOD is different or PCOS is different. In the past, they used to call as PCOD, like polycystic ovarian disease. Of late, over a period of time, with the medical advancements, we came to know that apart from the polycystic ovaries, these women are associated with some other endocrinal problems also like diabetes, obesity, dyslipidemia. All these are associated with the women with polycystic ovaries. So later we have labeled it as polycystic ovarian syndrome. There is nothing like PCOD is something different and PCOS is something different. Over a period of time, we came to know more about these polycystic ovaries. After that, they have labeled currently as polycystic ovarian syndrome. So as per us, we call only PCOS. There is nothing like PCOD. PCOD is a disease. Now this is a syndrome because it is associated with multiple clinical features. We are currently calling as PCOS.
So very great, ma'am, that you have provided your very experienced insight on, because I myself till date we were thinking that what is the difference between PCOD and PCOS. I think now rather it is very much clear that it is PCOS.
Yeah.
Over to you, Kavitha.
Yes, ma'am. As ma'am mentioned, here in this picture, we can see healthy ovary and polycystic ovary. Fluid-filled sacs, here we can see.
Yeah, go for next.
What are the causes for PCOD and PCOS? Hormonal imbalances. Imbalance in reproductive hormones, mainly high levels of androgens like testosterone. This imbalance disturbs the normal menstrual cycle and leads to form small cysts on the ovaries. Insulin resistance. Insulin helps regulate blood sugar levels. Here, insulin resistance, which in turn can increase androgen production and disturb ovulation. Genetic factors. PCOS often runs in families. Up to 70% of daughters of women with PCOS also develop it. But genetic variation does not fully explain the high incidence within families.
So as we know, as you have cleared between PCOD and PCOS, and I think it is more on the side of clearing the myths and facts. So one myth or fact, whether it is imbalances of testosterone forms a cyst in the ovaries, whether it is a myth or fact, ma'am.
Actually, testosterone is not the main reason for forming of the cyst. It is basically the regulation of the hormonal level for these things will start from brain. So these women will have abnormal LH levels. All these will contribute to the formation of the cyst, and it is mainly testosterone which is not increased in these women. Because of the insulin resistance, there is a binding hormone called sex hormone binding protein. Those levels will be decreased because of the insulin resistance. So the free hormone levels will be increased, which causes the clinical features of abnormal hair growth. It is not per se the testosterone levels which are high will cause the cyst. It is basically the insulin resistance which increases the testosterone levels. And these cysts which are formed is because of the imbalance of the down regulation of the hormones from the brain level. Both are different entities.
Okay, ma'am. And one more, is PCOS runs in the family, like whether it is a myth or fact?
It is not a myth, it is a fact. It runs in families. When we see these women with PCOS, around 50% of the first degree relatives, especially females, are affected with the polycystic ovarian syndrome situation, and even their male relatives are also associated with the metabolic issues like this dyslipidemia, diabetes. So even the male relatives are associated with metabolic issues. Female relatives, around 50% of the female relatives will be affected with this similar situation.
Over to you, Kavitha.
What are the risk factors? Family history. If any of the family members has this syndrome and disease, they are at higher risk. Obesity. Being overweight or obese are high risk. Sedentary lifestyle. Lack of physical activity and a sedentary lifestyle can increase the risk. Ethnicity. Mostly South Asians have a higher rate of this disease.
So every woman with PCOS will be in the parameter of body metabolic indexes will be high, or they'll be termed as obese or overweight, ma'am?
Definitely, obesity is one of the clinical feature what we see in these women, obesity or overweight. But there is nothing like hard and fast rule that all the women with PCOS will be obese. there are women who are lean also, which can be having PCOS. So it can be present in obese women and even lean women also, we can expect this condition.
Okay.
Here we can see signs and symptoms. Infrequent or irregular periods, excess hair, particularly on your face, chest and stomach. Difficulty controlling weight, thinning of hair, acne, infertility, tiredness, mood swings, raised cholesterol and under or overactive thyroid absent.
So I think this hirsutism, I think this is one of the very growing problem among the adolescent female girls. And I think they have a lot of anxiety issues when they confront the society or when they talk to their peer groups and all. So what is your opinion on what is the best treatment for hirsutism? Is this be completely cured while female has a PCOS?
Yeah, that's a good question, which many of the patients will be facing this problem. So because of the excess free testosterone or androgen levels, they'll be having this excess hair growth. So for them, there are a set of medication which we can recommend, like combined hormonal contraceptives for the reducing the hair growth. But these medications will take at least around 9 months time for us to get some improvement. So meanwhile, we can advise them to go for some temporary things like bleaching or waxing, just for them to build up the confidence to remove the hair like that. If they want to have a long-term effect for that, already the hair which has already formed will not go. Further new hair which will come will be controlled by these medicines. So already the hair which has already come, we have to take care of that. Like depending on the patient situation, they want to go for only simple things, they can go for waxing or bleaching to remove the hair which has already come. Or they can opt for some other procedures like thermoelectrolysis, or they can go for laser therapy also. So these therapies will give them a little bit long-term effects. So anyhow, they regularly need to go for these treatments apart from medication for at least a period of 1 year. So by that time, the hormone levels will be controlled and the things can be under our control. And very important thing is PCOS is one of the reasons for hirsutism. So when a woman presents with hirsutism, we need to do a proper checkup to identify any other reasons are also there for hirsutism. So we have to rule out all other conditions. Then we come to a conclusion that PCOS is the only reason for this patient. Then we have to follow this treatment for the patient.
As we discussed in previous slide and ma'am's discussion, here we can see alarming signs and symptoms. What is the role of hormones in PCOD and PCOS? Androgens like testosterone, luteinizing hormone, follicle stimulating hormone, estrogen, progesterone, and insulin.
So how often these hormones levels to be checked for those females who are affected with the PCOD, ma'am?
Yeah, these are the battery of the tests which we run in the patients presenting with the symptoms of PCOS, mainly for the diagnosis. We don't ask them to go for the tests again and again to see whether they have come down or not. So we do the test only once, just for the diagnosis.
Okay.
You need to repeat the test again and again.
Yeah,
How we-
over to you, Kavitha.
How can we treat PCOS? With birth control pills, these help to control menstrual cycles, lower androgen levels, and reduce acne. Diabetes medication. This is often used to lower insulin resistance in PCOS. A change in diet and activity, medications to treat other symptoms. Coming to our part, it's nursing management, education and counseling. Educating women about this condition, their symptoms, complications, and available treatment options such as healthy eating, regular exercise, and weight management. Symptom management, to provide information on hormonal contraceptive methods, tropical treatments, refer patients to specialists for further evaluation and management. Irregular menstrual cycle should not be ignored.
So when we are discussing about this symptom management, and I would like to ask here the common, questions which nursing also would like to know. What are the long-term associated complications with PCOS, and how this hormonal contraceptive methods, precautions, do's and don'ts to be taken care while female is on these pills.
Yeah, that's a good, very important question, because polycystic ovarian syndrome is associated with several long-term side effects also. These women who are presenting with the PCOS, they can develop gestational diabetes in pregnancy. They are at high risk of developing gestational diabetes, and they can have several metabolic issues also, which can present with type 2 diabetes mellitus, dyslipidemia, hypertension, increased risk for cardiovascular disorders. And because they will be having these excess hormone levels, it can cause endometrial hyperplasia. So these women are also at increased risk for endometrial carcinoma. So these will be the long-term side effects for them. So whenever the women presents to us with PCOS, we definitely have to educate them about the long-term effects also, because they'll be mainly thinking that we have to give some medication so that the situation will totally stop. Like how we take paracetamol for fever, with the medicine, the fever will go. But this is not a situation like that. Once they are diagnosed with PCOS, they have to take proper care, lifestyle modification, regular exercise, weight management throughout their life. This should be a part of their life. So when the weight is under control, they are properly taking care of their diet, all the clinical features will be under control. Whenever they are not properly following the things and their weight increases, then at any point of time, their symptoms can flare up. So very important thing is we have to properly educate the patient that this is a situation where it's not going to disappear completely. When you have a good lifestyle and you modify your diet, all this we can get into control. And they should be properly educated that they need to follow this throughout their life, because this is associated with the long-term complications. So they have to take care of this issue throughout their life.
So I think very well spoken about the coping up strategies among the female adolescent girls, especially because they always have this factor called role confusion. They look themselves at the mirror all the time. Maybe the hirsutism and other panic parameters are always the concern things. Okay, ma'am. So these are the coping strategies, and how one should take care when the well-balanced life is being taken care.
Nursing management includes emotional support, supporting patients emotionally, like on their concerns and anxieties. Monitoring and follow-up. Nurses can assist in monitoring and effectiveness of treatment and interventions along with the doctors. Collaboration. Nurses work with other healthcare professionals like physicians, endocrinologists, and dietitians to provide comprehensive care. Dietary management. Friendly diet includes unprocessed foods, high fiber foods, fatty fish including salmon, tuna, sardines, and mackerel, kale, spinach, and other dark leafy greens. Dark red fruits such as red grapes, blueberries, blackberries, and cherries. Broccoli and cauliflower. Foods to be avoided.
So here, like the again common myth and myth which the society they follow is whether they always ask whether the broccoli is good for PCOS and thyroid. So when they go to supermarket and always they are in dilemma whether to buy broccoli for their own eating pattern. So what is your take on this?
Yes, broccoli is obviously good for health because it is having low glycemic index and it is rich in fiber, and it contains abundant of chromium, which is going to control the insulin resistance, high insulin levels, which we see in these women. So it is definitely going to help, but it is not the only food which is recommended for the women with PCOS. The basic thing which they have to understand is they have to take a diet which is less in carbohydrates, less in fats. Means unsaturated fats and good fats, bad fats in this, they have to take mainly the good fats. Bad fats, they have to restrict the intake of the bad fats. So as Kavitha has told, this fatty fish, which contains salmon, sardines, these are all good fats which is present in them. So that we can take, but very important is restrict the carbohydrate intake. That is the main point which we have to educate the patient. Broccoli, they can take definitely. There is nothing like they have to take only broccoli to control this condition. It is one of the good foods.
Yes.
Foods to be avoided. Fried foods like French fries, potato chips, corn chips, and fried chicken or fish. Saturated fats such as butter or margarine. Red meat including hamburgers, roast beef, and steaks. Processed meat and hot dogs. Processed snacks like cakes, cookies, candy, and pies.
So are there any other food or food factors which should be avoided apart from the listed, which is being discussed right now?
Yeah, she has discussed everything. If you see on the list which she has projected here, it is mainly the carbohydrates, that maida and oil, which she is restricting. That is the only thing which we have to restrict. Carbohydrates are the main things which we have to restrict.
Let's have a conclusion part. PCOS is a common hormonal disorder. Early diagnosis, management of PCOS, long-time risk having PCOS can increase risk of developing type 2 diabetes and heart disease. Treatment should be based on the symptoms, lifestyle modification about diet and exercise. It includes medical therapies. Thank you.
So while presentation and while discussion, we have learned a lot many things, especially the myths and facts which, Madam, you have cleared today. Thank you so very much. And any final preventive aspect of it you would like to convey to the nurses, especially because we see nurses also has this very common PCOS syndrome, and they just ignores thinking that, okay, this month my period has been skipped, or maybe I'm not getting periods, or maybe second month again, or the second or third month again she gets her regulation of menstrual cycle. So what are the steps when she can seek your opinion, or when can she see the doctors? What is your last final conclusion on the same?
If we come to the etiology of PCOS, the exact etiology, we are not sure about the exact etiology for PCOS. Of late, as a gynecologist, when I'm seeing from the days where I was student and the days where I have become a consultant and practicing as a senior consultant now, the prevalence of PCOS has drastically increased. It is not so common in the past. So this is mainly because of the lifestyle. So our lifestyle, the foods what we are consuming now, everything is processed foods, like which is high in carbohydrates and oils, whatever foods, fast foods we are taking. And apart from that, our lifestyle, majority of us are having some stress in our life. This is also definitely is contributing for these PCOS issues. So I strongly recommend for all my patients, apart from the medicines what we give, like n number of medicines are there for PCOS depending on their problem, like contraceptive pills which we advise for the bleeding issues like irregular periods or heavy periods, something like that. And for the hirsutism, we advise anti-androgens, all these things. And so apart from all these things, these come to in the second level. The main very important thing, first what we have to recommend is lifestyle modification. So reduce the amount of stress, regularly practicing yoga, meditation, and having a proper balanced diet. I don't tell my patients like you eat this, you eat this, you eat this only because you are having PCOD, you eat that only. It is like a balanced diet we should have. And our diet should consist more of fiber, vegetables, nuts, all these things, proteins. but less of carbohydrates. So we should have a balanced diet with reduced carbohydrate intake and regular exercise every day, at least for 45 minutes to 1 hour, is very, very important. So if we are properly following this lifestyle modification, that is going to take care of the situation to the maximum level. And that is the treatment which need to be continued throughout. And the medicines come to the next level. See, if the woman is suffering with infertility, we give them medicines for egg release and pregnancy. If the woman is having periods issues, we give them hormone tablets. So these are going to work only temporarily. Unless we have this basic step of lifestyle modification, the medicines are not going to give them long-term effects. So whenever they are having these periods issues, there is nothing from their side to get panic and rush immediately to the doctor. They can observe at least for a minimum of 3 months to 6 months. So if their periods are getting irregular, they have to first think, what is the reason? Why my periods are coming irregularly? They should not neglect or they should not get over panicked. They can definitely come to the doctor and have a basic health check. See, apart from PCOS, there are so many other conditions also like thyroid, which can also cause the periods issues. So at least, or they might be having simple thing like their hemoglobin will be less. With that also, they will not be getting proper periods. So at least one basic check they can do with a gynecologist. Identify the reason. What is the reason for this? If there is no identified reason, then definitely once they improve their lifestyle, then their problem will be solved. So if there is anything identified among the reasons for the irregular periods, then we can correct as per the problem.
Thank you, ma'am, for the very, very simple tips. I think everyone can strictly adhere to the same. I thank you for the very beautiful session, and thank you, Kavitha. And everybody else, every Thursday we will connect again 3 p.m. for the beautiful webinar. And thank you so much. And thank you, doctor. And thank you, Kavitha. Thank you, ma'am.
Thank you, everyone.